So today's lecture is going to be about the vertebral column, also known as the spine. So the vertebral column is formed from 26 irregular bones that are connected in a way that allows us to have a lot of flexibility. Our vertebral column actually has an S-shaped curve, and that's what allows us to stand upright and be able to walk without falling on our face. Your vertebral column starts at the very base of your skull and extends all the way down through the pelvis. And its job, of course, is to surround and protect those nerve endings that make up the spinal cord. There are a lot of attachment points for your back muscles as well as attachment points for the ribs. They actually connect to the vertebral column. Every rib connects to the vertebral column. When we were a fetus and an infant, we actually had 33 separate vertebral bones. But as we began to age and get older, 9 of those bones fused together, which formed our sacrum and the coccyx. So each bone is called a vertebrae, and so we have a total of 24 in our spine. The average spine is about 28 inches long and it's divided up into 5 divisions. Most individuals, or all humans, have the same number of cervical vertebrae, and most have the same number of every other. But however, there is a 5% difference in the variation in the number of the vertebrae in other humans from other regions. The 4 curvatures give it that very distinct sinusoid or S shape to give us that flexibility. So the divisions of the spine are the cervical vertebrae, there's 7, the thoracic vertebrae, which would be 12, the lumbar vertebrae are the next 5, and then we have the sacrum, which is our hip bones and pelvis, and then the coccyx, which is the tiny little end at the very bottom of the spine. And here's a picture of it, and you actually have this diagram in your packet or in the Google Classroom so that you can color it. And you will see this picture on your diagram test. So you need to be able to label each one of those divisions of the spine. So there are a few homeostatic imbalances of the spine. One is known as scoliosis. Scoliosis is an abnormal curvature of the spine in the thoracic region. So here in this region is where you see this abnormal curvature. It's very common in females, or commonly found in females, not quite as common in males, but doesn't mean that a male can't have it. And what it does is it causes pressure on one side of the spine, and sometimes it will cause the hips to be a different height and the shoulders a different height. And if the curvature becomes too great, they will go in and do surgery to straighten the spine. The next imbalance is known as kyphosis. It's also an abnormal curvature, but this one is caused in the thoracic where they actually bend forward. So it's a anterior bend, and it causes hunchback in older adults, usually because of compression fractures in the spine. And then the next one is lordosis, which we know is swayback, and it's an exaggerated curvature in the lumbar region. So on the test, if you're asked to explain them, you need to be very specific as to where the abnormal curvature is, because all 3 are abnormal curvatures. So if you just say an abnormal curvature of the spine, I'm not going to know if it's scoliosis, kyphosis, or lordosis. So you need to be able to tell me where it takes place. There are ligaments of the spine that run along the front and back of the spine, which allows your spine to have some flexibility, but it keeps it from hyperextending or hyperflexing. And then each individual vertebrae is connected to the one above or below it with short ligaments. In between each one of our vertebrae is a disc. That disc is made up of 2 parts. You have a very rubbery consistency that's sometimes called the rubber ball. That's the nucleus pulposus. That is very elastic and compressible. And then around it, we find a very thick connective tissue known as the annulus fibrosus. And it's basically a girdle that makes that rubber ball stay extended to keep the vertebrae from touching one another and to resist tension. Their job is to act like a shock absorber, and it's about a quarter of your spine's length. When you get up in the morning, you're actually taller in the morning because as you go through the day, that intervertebral disc begins to flatten because of gravity. A lot of times you'll hear of people having herniated discs or ruptured disc. This is what they're talking about. That part that goes around the rubber ball will break. And so what happens is the rubber ball will ooze out, and when it does, it pinches on a nerve, and that nerve will then cause either pain or numbness in parts of your body. And so they have to sometimes go in and fix those if it's problematic for the patient. So the general structure of a vertebrae, it's an irregular bone, and each bone looks like it's got a hole running through it so that the spinal cord can go through it. And then what's different about each one is what's on the back side of it, your posterior side of the vertebrae. And they stack in a way that this canal forms so the spinal cord can pass through easily. And this is what a picture of your typical vertebra will look like. You can see this is the hole where the spinal cord would pass. Remember, see, it's a foramen, so we know that means hole. This is where the pad would sit, and the next one would stack right on top. And then these kind of interlock along your back, and this is what's on the very back of your body, your posterior side. So a few characteristics. The cervical vertebrae are C1 through C7. So remember I told you how every bone is named? Well, C1 through C7 are the names of the cervical vertebrae. C1 is at the very top next to the skull. C2 is right below it, and then all the way down to C7. C1 and C2 have no disc in between them, and they're designed in a way that allows our head to rotate around. The thoracic vertebrae are the next 12, and they're named T1 through T12. T1 at the top, T12 at the bottom of the thoracic section of the vertebrae. All of these have a rib attached to them, and that's what articulate means. And they have a long spinous process that points down on the very back of the vertebrae. So it's on your back, which would be your the most posterior side of your body. The lumbar, sometimes known as our small of our back, it receives the most stress. There's 5 of them, and they're labeled L1 through L5. A lot of times when you stand up for a long time, your back will hurt. A lot of chairs, and even in your car, you may have something you can adjust for lumbar support, so that way your lumbar doesn't take the brunt of your weight pushing down on it. Sometimes when you bend over, you can actually see the processes on the lumbar vertebrae sticking up, and the skin will kind of be raised up in those particular areas. Then right below that, you have the sacrum, which is kind of a triangular shaped structure. It is numbered S1 through S5, but they're all fused together. And from that point on, we typically call the vertebral column the sacral column. And then finally, at the very bottom, you have this tiny little bone tip that's known as the coccyx. It's known as the tailbone to us. It's actually 3 to 5 vertebrae fused together. It's nearly useless. There is a little bit of an indicator that it gives slight support for pelvic organs, but it tends to give people more trouble than anything. A lot of people will break their tailbone, and it causes them a lot of pain when they have to sit on it and then stand up from sitting on it.